All of us, probably once you are aware of some symptom called pain, we experience this sort of things. Now I get children 2-3 years age to the fellow who is dying, 99 years, 100 years fellows also coming with chest pain to each one of us. All of us, whether you are a doctor or non-doctor, all of us will be treating or hearing about chest pain. And it is one of the most probably dreaded symptom or a dreaded thing which nobody wants to experience. I was asking Dr. Ramchandra Reddy sir, did you have any opportunity when you have sent one patient home and that fellow developed resident? There was the only hospital those days which was catering to acute MI in that area. Each day there used to be around 20 to 30 admissions, but the ICC used to be 15 bedded because of the diagnosis problem in chest pain. And you can imagine now in a country like India where there is no insurance facility, where the public hospitals are not able to take care of the entire population, the amount of bad press you get daily, the chest pain, if you send home somebody after 9 o'clock, you can't sleep well. I'm telling you, a doctor who sends this patient home, he cannot sleep well that night, whether the patient may go home and sleep, because you are worried whether I have missed something. Always think with a high index of suspicion whether this fellow has chest pain which is dreaded or which can cause death, and think like that only and investigate. And you get sometimes in a casualty like our general hospital, 10-15 patients with various problems, a fellow with chest pain comes, you have to point out first whether this fellow requires urgent attention. Otherwise, chest pain fellow sitting outside our clinics or our casualties is a very common thing. So think of some primary angiogram. Then this is a guide injection. You can see in the left circumflex, there's a tight stenosis at the branches. In the left circumflex, this is the left circumflex. Then we put a wire, measured it, put a stent and dilated it, and you can see the perfusion in that artery afterwards. So he was relieved of the pain. But this procedure, doing it in the middle of the night, when your all senses are not correct, when your colleagues are not there, it's a difficult job. And much can do. But unfortunately, these days, people are not willing to do emergencies in the night, unless it's an institute. So a CT can rule out the aortic dissections, and acute MI can sometimes be diagnosed in future. If you have a doubt, you will probably have an MRI. The MRI will give you diagnosis within 30 minutes, and you can take them for further procedures.